Hello guys, welcome back to my YouTube channel. In case you are watching me for the first time, my name is Ann Mruka, and today, because somebody asked the difference between a CEO and a nurse, I will answer it in terms of differentiating between CEO and nurse. So make sure you watch this video up to the end, and so that to avoid forgetting, please allow me to read. Yeah. So nursing usually start from certificate, and CO we don't have certificate. So in nursing you will get that it will start from certificate, then higher diploma, then higher diploma, degree, masters, like that. And then what CO, it will start from what? It will start from diploma, higher diploma, degree, masters, like that. So nurses are the CEO, we don't have certificate. In nursing we have certificate, as it goes like that. And another thing, in terms of qualification, wow, where is it? Yeah, in terms of qualification, nursing, if you want to get into nursing, you want to get certificate in nursing, you need to have a mean grade of C minus. You need to have a mean grade of C minus, and then you will have C minus in English or Kiswahili, C minus in biology, C minus in either physics, maths, or chem. And then diploma, you need to have C plain. Right now it is C plain, mean grade of C plain, biology C plain, English or Kiswahili C plain, and then maths, chemistry, or what, physics, C plain. And then while CO diploma, you need to have C plain, and then mean grade of C plain plus English or Kiswahili C plain, biology C plain, maths or chem or physics also C plain. Another thing that you need to have, okay, that is between diploma in nursing and then diploma in CO. So in degree, nursing is C plus, mean grade of C plus, or C plus in the cluster subject, the above subject, the below subject, whichever, English or Kiswahili, biology, chem or physics, all of them C plus. And then degree, in degree kwa CO, they have two alternative. Alternative A, this person should have done biology C plus, chemistry C plus, maths, physics, either one, maths or physics C plus, and then Kiswahili or English, one of them C plus. And then alternative B, physics C plus, maths C plus, English or Kiswahili C plus, or biological science C plus. Those are in nursing and CO in terms of qualification. Another difference, nursing diploma usually take 3.5 years, and then in certificate 2.5 years, degree 3 years plus 1 year internship, and then CO 3 years diploma plus 1 year internship, and then also in degree 4 years plus 1 year internship. In terms of salary, nurses, their salary start from 65, that is degree level, no, diploma level, 65 to 70. And then 65 to 70, that is diploma. Certificate 50 to 60, and then if you do degree, it is 100 and above. And then also diploma in CO, their salaries start from 65 to 80, and then degree, that is 100 plus. And then in terms of marketability, nurses or nursing is more marketable, because you will get that in the hospital we need more nurses than CO. Obviously now the CO is not more marketable, but it is also, it is a good course, by the way, but nursing is more marketable than CO. Yeah, and I'm saying this because in the hospital you will get more nurses, and even if you go to a specific ward, you will get that maybe morning hours we have 4 nurses or 3 with 1 CO, and this CO will work up to evening, and another CO will come at night. And nurses, maybe you can get 4 nurses in the morning, and then 2 nurses in the evening, and then another 2 nurses in the at night. So you get, it is more marketable in terms of marketability. And then what else? Another thing that I have to say about CO and nursing, there is a lot of much work, there is a lot of work. And CO, it is ni kazi ni kidogo kiasi, yes. And then another thing that is also I have to say about nursing and CO, nursing, the theory goes hand in hand with the practical. That is when you are still a student. When you qualify, theory, practical is more than when you are a CO. So when you are a CO, there is a lot of theory than practicals. So nursing, more practical, little theory. CO, more theory, little practical. In terms of risk infection or infection to risk, nurses are more at risk because of getting infection, because they are the people who stay a lot, who spend a lot of time with the patient. And CO maybe will just come, do the write his notes or her notes and go away. That is why most of the time there are not many in the ward, and you find that nurses are the people who spend a lot of time with the patient, so they are at high risk of getting infection compared to CO. Another thing that you have to know about nursing and CO, nursing is recognized worldwide. It is known all over the world, but CO, it is only known in Eastern Africa. Yeah, nursing is only known in Eastern Africa only. That is why you will get that most of nurses are abroad, or yeah, they are in other countries, let me say like that. But CO, they only practice in what? In their countries. They cannot go to other countries. And then another thing, the union of nurses, we have different union. Nursing union is Kenya National Union of Nurses, and then CO Kenya Union of Clinical Officer. We have different unions. So, and also another thing that I have to say is that our scope of practice is different with that one of CO. Yeah, our scope of practice, nurses' scope of practice is different with that of CO. What do I mean by scope of practice? What we are supposed to do when we are in the ward is different before with those of CO. You will get that you will, as much as CO will know how to dress a patient, this CO will not do it in the wards. as much as CEO will know how to scrub in theater, this CEO will not go to theater to scrub when they qualify. So in terms of our scope, we have different scope. There are things which we do in the world that CEOs don't do, and also there are things that we do in the CEOs do in the world which we are not allowed to do. Yeah, so I think I've answered it. I've answered it well. So make sure, if you are watching this video, thank you for watching. Thank you for tuning in, and don't forget to turn your notification bell. Please don't forget to subscribe. Don't forget to like my video. Don't forget to share, and don't forget to leave a comment there so that I will, or you can answer any question in that comment section. I will answer it, or you can go to my DM in any platform. I'm only using the same name, Tesha Mroka. I will answer those questions. So thank you for watching this video. Let's meet in my next video. Bye.